Welcome everybody, thank you for being here. Today we are going to spend a little time together and review the alphabet. Yes, the alphabet, but this time it is the alphabet soup of Medicare. Do any of you eat the Campbell's soup with the letters in it? I remember I had it a handful of times as a kid, and let me tell you, nothing made my mom more proud than her child spelling cat while eating vegetable soup. The point is that Medicare is notorious for a bunch of the same letters that describe different things. So you have Medicare Parts, A, B, C, and D, which is what we're going to go over in this video. And then you have Medicare supplement plans, A, B, C, D, F, G, K, L, M, N, and we're going to go over those in a different video. So let's talk about the four parts of Medicare, A, B, C, and D, to help clear up some confusion. And if I did my job right, you should understand how Medicare is put together, which will only help you make better decisions when it comes time for you to go on Medicare. Now we have this video broken up by chapters. So if you want to watch all the way straight through, you can, or if you want to have control over what I say and when I say it, you can skip around using the chapters down below. For each letter, I'm going to go over what it covers, what it costs, and the gaps that it doesn't cover, as well as some quick recommendations on how to fill in those gaps. All right, so first, why are they called parts and why are they letters? Well, back when the original Medicare Act was signed into law in 1965, there were two sections of the bill marked Part A and Part B, which outlined the specific coverages under those parts. This is why Parts A and B are referred to as original Medicare, and we'll cover these first. So Part A and B are handled by the federal government, and that means that the benefits and the rules and the regulations are all set by the government. Hospital bills, medical bills, and the payment of those bills are handled by the government. So let's start with Part A, and we'll go over what it covers. Part A is described as your hospital coverage, but it covers more than just hospital stays. In fact, it covers a total of four different areas of healthcare. So number one would be your hospital stay. That was easy. Number two is skilled nursing facilities. Number three is some home health care. And finally, number four is hospice care. So let's go through each of these in a little bit more detail. With the hospital stay, the easiest way to think of this is your rent to stay in the hospital. When you're admitted into a hospital, meaning you are checked in and you stay and when you receive treatment, you are now classified as inpatient. Well, there's a lot that goes into staying in a hospital. Your room, the bed, the sheets, the laundry, the heating and air conditioning, the lights, the food, the administrative staff. You get the idea. So there is a bill that the hospital expects to get paid to cover all of that stuff. Anything billed under that hospital stay is classified as a Part A hospital expense, and that's going to be covered under Part A. The actual physician charge is not under Part A because that is coming later. The second thing that Part A covers would be skilled nursing facilities. And a big point of clarification here is that skilled nursing facilities are not assisted living facilities. These are not nursing homes. They are not Alzheimer or dementia facilities. All of these are not covered by Medicare. Think of skilled nursing facilities as rehab, where after you've had a procedure in a hospital, you go to a skilled nursing facility to get rehab, get better, and then go home. The third thing covered by Part A is some home health care. This would apply if you are needing home health care immediately following a hospital visit or a skilled nursing facility stay. Other forms of home health care are billed under Part B, which we will get to in a minute. And finally, number four, hospice care, meaning end-of-life care or palliative care for those who are terminally ill. Palliative care improves the quality of life and minimizes suffering for the individual, but it is not meant to cure. So that is what Part A covers. Again, it is mostly facility rent, if you will, with a couple extras like home health care after you stay in a facility and hospice care. All right, let's move on to what Part A costs. And the good news is that for most people, Part A doesn't cost anything as long as you or your spouse have worked for 40 quarters and contributed to the Medicare system through your taxes. There are 4 quarters in a year, so this means that as long as you or your spouse, either or there, it doesn't have to be both, as long as you or your spouse have worked for 10 years and contributed to the tax system, you don't have to pay for Part A coverage. If neither you nor your spouse have worked for 40 quarters, you will have monthly costs for your Part A coverage. That cost will depend on how many quarters you or your spouse have worked, and you can find those amounts on our website. The link is in the description because these amounts change every single year. So now we're ready to talk about the gaps that Part A leaves and that you are responsible to pay. And there are three. And the first is a deductible. A deductible is the dollar amount that you have to pay first before Medicare Part A starts to cover anything. That dollar amount is set by the government and it changes every year. But right now in 2022, that dollar amount is $1,556 per benefit period. Our link in the description goes to our site where we have the current year amount if you are watching this in the future. The Part A deductible works differently than any insurance deductible you've likely ever had in your life, and it all gets pretty complicated pretty quickly. With traditional insurance deductibles, you have to meet them once a year, and then you don't have to worry about them again until the next year. Not so with the Part A deductible. The Part A deductible is a per benefit period deductible, not an annual deductible. And what that means is that you could be responsible for multiple Part A deductible payments in 1 year. So what is the benefit period for Part A, you might ask? Well, it begins when you're admitted into the hospital or a skilled nursing facility, and it ends when you have been out for 60 consecutive days. So let's go over an example with our fictional friend Jane. And Jane gets admitted into the hospital on March 1st. She's in the hospital for 3 nights, and she goes home on May 4th. Jane is responsible for the Part A deductible amount. Well, a couple weeks later, Jane goes back into the hospital on March 20th. Since Jane is still within 60 days from her first release date from the hospital, she is not responsible for paying the deductible a second time. Jane stays another 3 days in the hospital and is released on March 24th. She goes on with life without having to revisit the hospital. Now, what if Jane had gone back into the hospital after more than 60 days? Well, if Jane were to leave the hospital and then return after 60 days, say 61 days later, Jane would be in a new benefit period and responsible for another Part A deductible. So again, this means that you could have several opportunities to pay this deductible throughout the year. So that is the first gap of Part A, the deductible. The second gap with Part A would be the hospital copays. Now, your Part A deductible covers you for the first 60 consecutive days in the hospital. After 60 consecutive days of staying in the hospital, copays start to kick in. Now remember, this is a different conversation than what we have just been having with the benefit period. Remember that the benefit period resets when you've been out of the hospital for more than 60 days. Copays come into play when you've been in the hospital for 60 plus consecutive days. So days 0 to 60 are covered by your deductible. In 2022, for days 61 to 90, you're responsible for a $389 copay per day. Days 91 to 150, you're responsible for $778 per lifetime reserve day. And I phrase it like that for a reason, which I'll get to here in a second. But if you're in the hospital for more than 150 consecutive days, you are then responsible for 100% of the hospital cost. Okay, so lifetime reserve days. The 60 days that make up days 91 to 150 are called lifetime reserve days. You only get 60 lifetime reserve days for your entire life under Medicare Part A. Once you use all of those 60 lifetime reserve days, if you end up in the hospital again for more than 90 consecutive days, you're responsible for 100% of the hospital charges after day 90. So let's use Jane again as an example to help illustrate. Jane is about to have some serious health challenges. She's admitted into the hospital and stays in the hospital for 59 days. At this point, she's just responsible for her Part A deductible and will not have any copay responsibilities. Well, she ends up staying for 11 more days. And since she was in the hospital for more than 60 days, she will be responsible for the daily copay for each of the days 61 through 70. That's 10 days at the daily copay amount. Well, 2 years later, things get worse for Jane. She's admitted into the hospital again, this time for 160 consecutive days. She's responsible for her Part A deductible again. She is responsible for the daily copays for days 61 to 90. She's responsible for an even highly daily copay for days 91 to 150. And then for days 151 to 170, she is responsible for 100% of the hospital costs. So as you can see, this is a significant coverage gap and something to be aware of. All right, we have one more gap to cover with Part A, and that is the skilled nursing copay. Before we jump into that, just know that there are ways to cover these gaps. So before you go down the dark, depressing hole of, I'll never be able to feel safe, don't worry, it'll all be okay. Okay, back to the third and final gap in Part A, skilled nursing facilities. One of the common names for these is SNFs, which I think sounds kind of funny, but it is a lot easier for me to say than skilled nursing facilities over and over again. So Part A does a really good job at covering SNFs for the first 20 days. In fact, it's so good that after your Part A deductible, Medicare covers 100% of those costs for the first 20 days. After 20 days, there are some copays that are daily copays. We have the current year numbers in the description and our website. But in 2022, if you're in the SNF for 21 to 100 days, you have a copay of $194.50. And after day 100, you get to pay 100% of the costs. Yay. In all seriousness, though, how are we feeling? A little bit overwhelmed with these gaps? Let's help you out there. Most people do not choose to get original Medicare only with no help. Most people choose to get either a Medicare supplement plan or a Medicare Advantage plan. And with either of those plans, the gaps in Medicare Part A and Part B, for that matter, become much more manageable. Supplement plans are going to cost you more from a monthly premium standpoint, but they fill in these gaps left by Part A nicely. Medicare Advantage plans cost you less monthly than supplement plans and fill in the gaps left by Part A, just not quite as fully as supplement plans. We have several videos detailing those for you, specifically between Advantage and supplement plans, that you need to check out. But that wraps up Part A for you. Let's move on to Part B. Like Part A, Part B is a piece of original Medicare, meaning that it is provided and administered by the federal government. Part B is your medical coverage. So where Part A covers healthcare facilities, think of Part B as covering the services that you receive from providers of healthcare. So Part B covers things like inpatient and outpatient doctor services. This includes your primary care providers, your specialists, your surgeons, and things like that. Part B also covers outpatient care like labs, tests, x-rays. Part B also covers therapies like physical therapy, occupational therapy, and chemotherapy. So Part A is the facility. Part B is the services from the providers of healthcare, maybe within that facility. So what does Part B cost? Well, Part B has a monthly premium that is basically the same for most people, but it changes every year. So the 2022 Part B premium is $170.10. And if you're watching this later than 2022, the current year amount is listed in the video description on our website. Part B premiums are income-based. So if you have a higher income, those with higher incomes actually pay a higher premium for Part B. Now, what Medicare does is they use a 2-year look back to determine your income, meaning that every year Medicare will use your tax return from 2 years prior to determine your income tax bracket and your Part B premium amount. We often get asked if Part B is required, and the answer is no, but if you choose not to enroll in Part B during your initial enrollment period or the special election period, there is a possible penalty of 10% per year for each year that you delay enrollment. And guess what? That penalty lasts the rest of your life. So this is an incredibly important topic that we have an entire video dedicated to that helps clear up when penalties happen and when they don't. So please go watch that one when you have the time. It should be up here in the corner. Now there are 2 gaps to be aware of with Part B. One is small and one is not so small. So the small one is the annual deductible. This is much easier than the Part A deductible because once you meet it, you don't have it anymore. Part B deductible payments are only for that 1 year, and then they will reset in the year. You won't have multiple within that year. And that amount in 2022 is $233. The second not so small gap with Part B is 20% of all Medicare eligible expenses. You heard that right. Medicare will cover 80% of all approved Part B expenses. You are responsible for 20%. And guess what? There is no maximum dollar amount on that 20%. So if you have $1 million Medicare Part B claim and you only have original Medicare, you have a $200,000 bill headed your way. So how would you cover Part B gaps? Well, the answer is the same as Part A. A Medicare supplement plan or a Medicare Advantage plan will fill in the gaps that Part B leaves, but they do it in slightly different ways. But either way, you will still be feeling much, much better and more protected against financial ruin with a supplement plan or an Advantage plan. So that finishes up original Medicare, but there are 2 more Medicare Parts that are provided by private insurance companies and not the federal government. They are Part C and Part D. So with Part C, like the others, I'm going to go over what it is, what it covers, what it costs, and some gaps to keep in mind. Part C is more commonly known as Medicare Advantage plans. Remember that Parts A and B are original Medicare. They're provided and administered by the federal government, but Medicare Advantage plans are different. They fall outside of original Medicare. That means that they're offered and administered by private insurance companies, and they take over the responsibility of the federal government with Part A and Part B, and they also include Part D. So Medicare Advantage plans are kind of like a combination of benefits bundled into one convenient package. Advantage plans often come with other perks like dental and vision and hearing benefits, gym membership reimbursements, transportation to and from visits, and meals during and after hospital stays. You must first sign up for Parts A and B to get Medicare Advantage plans, but once you get an Advantage plan, that insurance company takes over all of the responsibility for Part A and Part B benefits and claims. This means that you will carry around one insurance card from the insurance company rather than your red, white, and blue Medicare card. That doesn't mean throw away your Medicare card. Don't throw away your Medicare card. Just know that you don't need to carry it with you on your person when you have a Medicare Advantage plan. Let's finish up Part C with some things to keep in mind about Advantage plans. The insurance company that you choose will impact your Advantage plan benefits. Each insurance company offers slightly different benefits. You're confined to that insurance company's network, and you must see providers within their network to avoid paying for all doctor charges. The monthly premiums that you will pay will depend on which insurance company that you choose, and the benefits that are included in the plan and where you live also impact that premium. Finally, the cost sharing, or the amount that you're responsible to pay for services, is dependent on the insurance company that you choose. This would include things like copays and coinsurance. So that wraps up Part C, which wasn't so bad, but buckle up, Part D is next. Now think of Part D as standing for drugs because it is your prescription drug coverage. You can purchase Part D coverage on its own, or as I mentioned before, it's often packaged within a Medicare Advantage plan. Part D plans have a monthly cost if you purchase them separately. Now there's a wide range based on where you live, the medications that you take, and the benefits of each plan. The average Part D premium cost this year is $33 per person per month. But know that there are plans out there that have lower monthly premiums, as well as other plans that get pretty expensive for more coverage. If you get a Medicare Advantage plan, they most often have Part D coverage included in the Advantage plan itself with no additional cost to you. You have 4 phases that you need to be aware of when it comes to Part D plans and their coverage. And the best way to understand them is actually with a donut. So they are the deductible phase, where you are responsible for paying the full cost of your medications until you meet your plan deductible. Once you've paid enough to meet your plan deductible, you move into phase 2, which is the initial coverage phase. In the initial coverage phase, your insurance company will pay for part of your medications, and you will have a copay, which is a set dollar amount, for example, $10 per prescription, or you will have a coinsurance amount, which is a percentage of your medication costs. So for example, 20% of the drug cost. Once the amount that you have paid in the form of your deductible and your copays and the coinsurance and the amount that your Part D plan insurance company has paid reaches a certain dollar amount that changes every year, but is $4,430 in 2022, you're ready to move into the next phase called the coverage gap. Now, the coverage gap is commonly referred to as the donut hole, which is why our donut analogy starts to make sense. While you're in the donut hole, you are responsible for 25% of the drug cost until you have paid $7,050. We have a Part D deep dive video you're going to want to check out that goes into a lot more detail into how this all works. It's not as straightforward as it probably already doesn't appear. I've spent my entire career in health insurance and benefits. I've been in pharmacy benefits, I've been with a health insurance company, and now I'm in Medicare. And I can tell you that Part D is one of the most complicated health insurance topics that I have ever encountered. So watch that Part D deep dive video. Now, once you've made it out of the donut hole, you are ready to move into catastrophic coverage, where you would be responsible for the greater of either 5% of the drug cost or set copayment amounts that are shown here based on brand and generic drugs. Whichever is the higher amount between these set amounts and the 5% number is the amount that you'll pay. Now, there is no out-of-pocket max in the traditional sense like what you're used to. You will still have those amounts to pay while in catastrophic coverage until January 1st, where you will go all the way back to the deductible phase and you start this whole process all over again. Goodness gracious, we made it through Part D alive, but barely. It's a lot. I get it. The good news is that it doesn't have to be overwhelming. As you have questions about these letters or any Medicare topics, don't hesitate to reach out to us on our website or here in the comments. We have a lot of other videos on Medicare that help clear things up, so make sure you subscribe to this channel to see the new videos that we put out, as well as to watch some of the old ones that we've already got that cover a lot of these topics. If you found this video to be helpful, can I ask you a special favor? Will you hit that like button? YouTube is so vain, and this video needs things like likes and comments to feel special and get shown to other people. So if you could hit that like button, it would be very helpful for this channel. I hope this has been helpful. As always, I appreciate you and thank you for watching.